Hey everyone, I'm Dr. Mona here for our weekly live with Peds Associates, talking about any updates. Every week we go through the current data, meaning how many children have been diagnosed with COVID since the last week. We get data from the American Academy of Pediatrics and the Children's Hospital Association. And then I go through any major topics that are on people's minds, and then I'm going to do a Q&A. So welcome everyone. I love when you all come in and wave. It makes me really happy. And if this is your first time joining us, thank you. Please, if you enjoyed it, make sure to share it on your stories or at least tag a friend. Our goal here is to make sense of all of the advice and guidelines as to how they apply to families. I know sometimes it can be really confusing. So what I do is just say, hey, here's the guidelines, here's best practices. This is what you should consider when you make choices. And remember, everyone's decision making will be a little bit different, right? What works for you and your family may be very different for what works for another family. So the goal here is just to understand what we know now. The reason why we decided to do this weekly now is that things are changing very quickly. So this used to be, something that was like every few weeks, but then we realized that, oh wow, with everything that's coming out, right? There's FDA now talks about needing a booster for immunocompromised people. We have Delta variant. We are doing this every week. So my other disclaimer is that this is information as of today. Things may change week to week, but we are here to do this every week so that you feel a little bit more supported, as to what's going on and how to navigate this. So welcome everyone who's joining. Thank you. I do like to start relatively on time because we do save this, and I just want to have more time for Q&As. And like I said, I'm going to do a little short spiel today. Today's a very short talk, and then I'll have more time for Q&A, just because I know people have had a lot of questions about back to school, and so many other questions. So we'll get into that. Yes, and everyone's asking about vaccine timeline, and I'll go over what we see right now. And that'll be the first question I go to, but everything is still kind of just waiting on so many different factors, but I'll get into all of this, and any questions that I can answer, I will for the hour. So first, as I always do, I want to go over the data we have right now. And I said this last time, the data is reported by 23 states, so we don't have data from every state. So this data is probably much higher. We have to remember that. But so this is actually, I guess it's not really useful to say the data because the data is not fully encompassing, but the percentages are probably pretty accurate. But we don't have a lot of states reporting hospitalizations for children right now, or just reporting their numbers. So I think it's really important that states start to remember to do that. And I think they will when they start to see that, hey, this is starting to kind of go into the pediatric population. But for so long with the pandemic, we weren't really focusing on kids, which I think was a huge tragedy in terms of just not looking at, people thinking that this was over. But I think it's really important going forward that we get that data. So right now, 4.2 million children have had COVID, 5,700 for every 100,000 children. So about 5.7% of children have tested positive for COVID since this pandemic began. In the last week, we've had 93,824 COVID cases in the last week in children. The week prior was 71,000. So we are seeing an increase. Just to put this into perspective from the data that we see, the highest was 211,000 back in January of this year. So remember when we had that surge around the holidays? That was the highest peak we've seen for children. So this is the second highest peak that we're seeing for children, even compared to the beginning of the pandemic. And it makes sense, we know this, because one, children are unvaccinated, so this virus is going to spread to people who are unvaccinated more so. And also, children are with other people more, So at the beginning of the pandemic, they were more indoors, they weren't going to school, everyone was social distancing more, so we didn't see it as much. So now this is a contagious virus, even more contagious than the original strain. And so yes, we are seeing more children get COVID, and it is a reality. And I'll go into just some supportive comments if you have had a child with COVID or you're worried about your child getting COVID. I'll kind of talk about just ways to kind of as a parent get through that, because it can be really hard. There's a lot of guilt associated if your child gets sick, and I'll kind of explain how I want you to kind of think about this and navigate this. Percent hospitalized is still about 0.9 to 1% on the data that we reported. I do have to reiterate that we don't have every state reporting hospitalizations, but that number, according to the data we do have in the states we do have, is still stable. So we're not seeing the increase from those numbers, but I know from just clinical practice that we are seeing a small uptick in Florida, where we are, in a lot of the southern states have been seeing an increase. And I said this last time too, that we still don't have a lot of that data because states are not reporting hospitalizations, which I hope will change in the near future. So that is basically the data. In terms of other information, we are going back to school. We are in Broward, so I'm located in Broward County. Miami-Dade is obviously close by too. School starting next week. I'm sure a lot of you have some questions about school and masking. The American Academy of Pediatrics, as well as Pediatric Associates, encourage masking. It's one of the best things we can do for our children who are not vaccinated. And right now, schools should be instituting masking requirements. I know some districts are still deciding, some private schools are still deciding, but the recommendation is vaccinated or not, mask. And I want to explain why this is so, right? Like, why are we having our school-age kids mask, and why, if they're vaccinated, just say you have a 14-year-old, why do they have to wear a mask? I know different schools may have different rules, but one reason is obviously for added protection, right? Just to protect everyone. Masking is part of the layers of protection that we do. So we socially distance, which I know in school is going to be a little harder because they're together. Social distancing, masking, vaccination, all three of these things, hand washing, all four of these things are part of the layers of protection we do to protect ourselves against infectious diseases that are, respiratory illnesses. So masking is part of that, right? Another thing that is concerning is how are the schools going to check who's vaccinated and who's not? Are people going to fall through the cracks? So that is why the AP recommends this sort of full masking for everyone, right? A lot of questions have come up. Well, what if and I talked about this last week, and I want to rephrase some of the responses. So someone asked, well, what do I do if my school does not have masking requirements? Your options here are weighing benefit and risk for your family. We obviously would want people to be masked, but if that's not happening, you have to think about, is there an option for my child to be e-learning or distance learning? If that's not an option, it's okay, well, I'm going to either see if I can cause change and allow masking, or I'm going to put my child in a mask at least, just so that adds some protection. The best protection is everyone being masked, right? Because even if you're masked, you want people around you also to do the same service and mask themselves as well. So it's really important to remember those rules, and I'll go through other questions that come up about that. But that can be really difficult if your school board or if a school is not following that, be very confusing. And it does come down to what you feel comfortable with also, but it is a recommendation. And I've said this before, this is not something that we imagine is going to be forever. This is just because the Delta variant is around, right? I understand people are frustrated with the mask on, mask off, mask on, mask off. And I agree. I understand that can be very frustrating, but things evolve as data comes out and as we see concerns, right? So I don't look at the ever-changing recommendation or, why this 3 months ago we were hoping that there would be no masks and now masks. I don't look at it as, I know it's frustrating if you're not in this field, but I don't look at it as frustrating when I think about how we have to adapt to what's happening right now. So like I said, 3 months ago, or maybe a month ago, I was even saying maybe we won't need to. Maybe because cases are so low and Delta wasn't here, that we could maybe go and not have everyone be masked because the transmission was so low. But unfortunately, we have a positivity rate of up to 20% in Florida right now. So if you're in Florida, this virus is out there. And we, in order to protect our children, especially if they're vaccinated or not, masking is that layer of protection that we can add if they're vaccinated, if they're not, just to help assure that we don't spread this further. And remember, the goal of all of this is to not only protect your child, but to protect our children's peers. The children's peers who are, we look at the big picture, we look at our community, we look at children who may be immunocompromised. We want to give everyone an opportunity to go to school. We want our children who are more high risk to be able to be back in a school setting. I mean, this is important for everyone. School is important. We want kids to be in school. We want them to be with their peers. We want them to be face to face because this is good for them. Another year of distance learning is difficult for you, difficult for the child, and we want them to be together, but there has to be some mitigation strategies to make sure that they are supported. Another common question I get asked, which I'm going to answer this one and then I'll go to all of your question, is why do we have to do all this and not do it for when it's flu season? Like, why is it happening now? Why can't we just go to what we were doing in flu? We didn't do all this. The reason is we don't have a vaccine opportunity for children yet. So we need to make sure that we have something offered to families to protect themselves. In the flu season, you make a choice. I'm going to get the flu vaccine or I'm not. You know the benefits and risks. You make that choice, right? Everyone has a choice there. Kids under 12 have not been given that opportunity yet because there's no vaccine for them. And this is still a relatively new virus, so it's different than the flu. And it's also, we don't know how it's affecting children. Flu, we know what happens with flu in kids. We can tell you, here are the complications if you get the flu vaccine, this is what happens. But COVID is new. It's still new. It's still new in that we're still seeing it in children for the first time at this degree with a new variant. So it's not fair to say, we did this with the flu. We don't need to, mask and do all that. I hear you, but it's also different in that this is a novel virus still in terms of the Delta variant. And also we just haven't had families be given the opportunity to have a vaccine available if they choose to do so. Maybe next year, like next summer, we may still see COVID circulating. But at that point, parents make a choice. Okay, I'm going to protect my kid with the vaccine. We're going to live like this is a flu, if that makes sense. We're going to kind of get boosters. That's what it's kind of looking like. But right now, just to be safe for everyone, remember, this is a public health crisis. We have to think about the greater good. I've said this many times. So we have to think about, yes, this is out of what I wanted to do. I didn't want my kid to go back to school again with a mask, if you're thinking that. But think about the big picture. We are doing this to protect each other. We're doing this so that we can get out of this mess. And then, once the kids get offered vaccines, once parents get them, then maybe we won't have this, right? You'll see the transmission lower. Even if we start to see spikes, parents will make a choice, hey, I want to vaccinate my kid or not. And at that point, it is almost a little bit more fair. Right now, I don't think it's fair to say, well, it's like the flu, we shouldn't have to do all this. It's a little different. So let me actually scroll up now to answer questions. We have a long time for questions today. We chose to do this because we felt like people had a lot of questions and I didn't have any, major updates. And I want to see what you all had concerns about. And thank you again for joining me while I scroll up. I'm very excited that y'all are here. You are so welcome. Thank you for doing these. This is so good for us. I love it. I'm so happy PA is, open to this. This is so great. When will the surge end? It's really hard to say. And I want to be, again, this is like a support group too. I told you that this is not just about education. It's just kind of as a mom myself and also a physician talking about how we're going to get through this. It's hard. As you all know, I'm in this very deep, being a pediatrician, my son's a toddler and I have a husband in the ER and we talk about this, we're like, what's the end point here? And it's hard to say. I think we're looking at other countries such as India and the United Kingdom, the United Kingdom also had a Delta surge. And then they plateaued and then they came down. They also at that point didn't have, they had their own vaccine program. We know the surge is going to end. It's just so hard to say given new variants coming, given, people are traveling, given so many different factors, the vaccination rates in certain communities. So it really is, a week by week basis. We know that Delta has a longer transmission rate, meaning 18 days versus the normal 14 days of the original. So when I kind of look at things, I look at every 3 weeks. So people ask me like, what about travel? What about this? Like, it's so bad right now. Like, in my opinion, it's not really great, the situation, that I look at it, okay, this is the next 3 weeks we're going to look at, the next 3 weeks. And when I say that, I'm looking at caseload. Are we starting to see case numbers plateau? Right now, we're not in children, right? Right now, we still are seeing that increase. So when I say this, it's important to always think about keeping your precautions up. The way we keep precautions up to protect our children are vaccinating ourselves and the adults around that child, masking, especially, in crowded places, indoor crowded places, outdoor crowded places, and obviously getting your child the vaccine if they're eligible, and then hand washing, the things that we would normally do always, right? These are how we can help reduce the spread of this. It's not about needing to isolate again and not see other human beings. It's about just being safe and precautious, right? I've mentioned this before, like, who are we interacting with, right? With the Delta surge being as it is in Florida, maybe, I know it's so hot right now, but maybe doing more outdoor evening activities, right? Indoor vaccinated, we know that there are still chances of breakthrough infections. We're going to hear about those more as the variant circulates, because remember, breakthrough infections are more likely to happen if the virus is high in a community. So if we are in Florida, I do like to take a little bit of precaution if you're vaccinated, and that means kind of going back to what I was kind of doing earlier this year, which was masking indoors, at stores, obviously being a little, going back to kind of semi-essential activities. Everyone's different as to what they're comfortable with, but I'm doing that because I have a child at home, right? I just want to kind of protect any chance of breakthrough infection, bringing it home. It's not perfect. Remember, none of this is perfect. We know that this is an invisible enemy or an invisible virus. You're just doing your best, right? You are making decisions knowing that, you know what? This virus is really bad right now out there, whether you're in Florida, wherever you are. I just want to take a little bit of extra precaution. Maybe you don't, but whatever you're doing, I would recommend masking in indoor places, because that's what we should be doing for everyone else. And just really thinking about what you feel comfortable with. Any update on the timeline? Okay, so this is actually really, it's hard because we're so optimistic that, by end of, August, September, I think it's still looking like that. They did want to enroll more children in the trial just to get even more data points, which I think is awesome. So I know it can be a little frustrating, like what's going on, but I look at it as this is actually really good that they want to get more children in the trial to look at safety and efficacy. So right now it's looking like end of September, but of course I'll keep you posted if that changes. I'm hopeful that that'll be the timeline. We do know that FDA approval, so right now, remember, it's an emergency use authorization for us, adults and 16 plus, but for adults, they're probably going to issue an approval or go through the protocol to issue an approval in the next month. So we may simultaneously see an approval for the vaccine, not just an authorization. And then we'll probably see the children 5 to 11 be authorized. So remember the difference between authorization and approval. It doesn't mean a short-skirted, approval process. It just means that in order to be authorized, you need a few months of data, 3 to 4 months. And in order to be approved, you need at least 6 months of data. So it's not like they short-ended the safety and efficacy. That's not what they do. It's just the number of months needed to be authorized versus approved. And that's why we support the vaccine, because it is safe and efficacious to get for your 12-year-olds plus. So I will keep you posted. I'm sure PA, will do these lives. If it does become authorized, we'll do a live that in the 24 hours, like just say it's on a Monday. We'll try to organize it and get something going for you all to, have some information. Do you see possible more severe disease in kids? So again, I am really hounding everyone for data. Like every day, like every Thursday, I research everything. Like I do my whole research on COVID just to make sure I'm up to date on everything. I actually had a call with the AAP today to plead with them to advocate for local governments and public health offices to release data. It was an amazing conversation. I just expressed all the frustrations that a lot of parents have. It was awesome. But yeah, one of the things I said is that we need to get people on the ground to help get data. We need data so that we can make choices. And part of that data is risk factors. Who are we looking at that is considered high risk for hospitalizations right now? We don't have numbers, right? And I know that's hard for parents because some of us want to make choices based on risk factors. When I look at the flu, for example, we know like under 1, is more high risk. We know like people with asthma for flu, right? We know these things. So far, we don't have that data. Everything is anecdotal, meaning everything is just what we're seeing, and that's not something we can always go by because we don't see the breadth of what's happening across the country. What we are seeing is that children do go in and leave the hospital. We have obviously seen some MISC. MISC is the inflammatory condition that happens a month after being exposed to COVID. With these children, they do have to see like a cardiologist sometimes for clearance. There was a report on long COVID, and I'm going to talk about that just briefly. This came out of the United Kingdom. Long COVID is like symptoms that happen weeks after having COVID, and I'm just going to tell you some numbers. Again, this was out of the United Kingdom, so this is not United States data, but they looked at, So they were looking at the United Kingdom, they were looking at 2 to 11. So long COVID symptoms are fatigue, headache, brain fog. This, if you were an adult with COVID, maybe you've had this. So fatigue, headache, brain fog, memory and concentration, sleep disturbances, changes in smell and taste. So these are symptoms that are happening longer after you've had your initial COVID. In United Kingdom, 9.8% of children 2 to 11 had symptoms of long COVID, and 13% of 12 to 16-year-olds had symptoms of long COVID 5 weeks after having COVID. And then after 12 weeks, 7.4% in the 2 to 11 group and 8.2% in the 12 to 16 group. So what we say by long COVID is just kind of these lingering symptoms. Now, we don't know what that means in terms of stuff after, right? If that is any impact of any kind. These are just subjective symptoms that the child is reporting. And it's more, they reported that it was more common in adolescents, meaning your teenagers. And this makes sense because maybe teenagers are more attuned to symptoms that can bother them. But does it mean that it's anything harmful? We don't know that yet. Like anything impacting their health. We don't know. But these are all subjective symptoms, right? Fatigue, headache, brain fog, memory, meaning subjective, meaning we can't test for it. It's the person describing. So it's really important to remember that we need more information. But I think it's just important to kind of hear. One of the things that we keep hearing is people focusing on the death rate for children. The death rate is so low. Why do we care about this? And death is not the only thing we care about. I think it's actually really sad when we focus only on death in children, right? I mean, any child dying is not something we want ever. So even if it's a 1% death rate, that's 1% too many. But it's also about everything else a virus can bring, right? Our goal here is to try and protect as many people from this as we can. We know that it's not possible all the time, right? I don't think anyone is living in a world that we think that we are completely can't get this ever. It's just, we do our best. And that kind of is my segue into as a parent, when you're making these choices, I really want you to remember that you are doing your best. I've had many parents ask well, I don't know, I don't want to put my child into school or daycare, but I have no other option. Remember, you are doing your best with the information and resources you have. So information meaning, okay, I know this variant is out there. I know that children can get this. I also know that generally children are not getting super sick. That's my information I know. Here are my resources. I don't have anyone else to take care of my child. I have to go to work. These are the things that I'm looking at when I make choices for my family. And that is so important to look at when we make these decisions and not judge other people. Obviously, I want people to be making choices that are helpful for the community also, but really understanding that everyone has different financial circumstances and doing their best to help protect their families and hopefully do any mitigation strategies we can do for the community as well, which is masking and vaxxing and all of the things that we've talked about. But do know that I know it's hard. I know these choices are very heavy on parents' mind. It's heavy on mine too. You go back and forth all the time deciding, well, what about this? What about this? And know that, if your child does get COVID, I know this happens, right? I've had friends who are physicians whose children have gotten COVID and they feel terrible. They feel like I could have protected my child. And as a mother, as a father too, or any caregiver, we feel that guilt. But I want to remind you that if that does happen, please remember that you are doing everything you can, right? You can only do so much and we can only control so much. So focus on the things that we can control, which is, like I said, I'm going to vaccinate. I'm going to look at my resources here, but I have to do what's best for my family. And have solace in that, understand that you are doing your best. And I know we all know it's very hard, and that's why these decisions don't come easy, and that's why you're here. But just know that I get it. It's not so clear cut all the time, and no one has ever parented in a pandemic. So it's you can tell your mom or something, they're like, oh, it's different. We're all going through this for the first time ever in a generation, and it's hard. So please remember that. Let's see. Anything we can do to get states to report data, advocate with political people, or is that all different channels? This is a great question. I talked about this today. One of the things that they were talking about is contacting the local chapter of the AAP, which I'm actually going to see if we can do. But there's really nothing. If I ever find something that can really like a petition or something, because I think it is important, I will reach out. It is a part of advocacy to just get public health information out there, and that's a great. Thank you for that support. Let's see. Will kids have to wait 90 days after testing positive from COVID to get to then get the vaccine. We don't know right now. We don't have that. Again, if anything changes when the vaccine comes out, but no, right now there's no waiting period. But if that happens, we'll let you know. If community spread is low, is one unmasked adult at an outdoor children's party high risk? So this is a very nuanced question. You are outdoors, so this is lower risk than indoors. That one unvaccinated person is in a community spread that is low. Remember, low would be under 3%. That's considered pretty low. Florida's 20% positivity rate. So kind of putting that into perspective, that's like, I don't know where you are, but I don't know if a lot of states are that low right now. When we say low for positivity rate, that means like there's just not a lot of virus circulating. But if it is truly low and it is outdoor, right, this would be something that would be considered lower risk. But think about what you're doing outdoors. Is it like a crowded party where everyone's like super in each other's faces and drinking and laughing? I mean, that's just kind of germ spewing. Then you may want to consider masking that person. But it really depends on how that party's going. If it's more distanced and people are pretty talking at a normal volume, then that's probably okay. Thoughts on sending my 3-year-old to pre-K? We don't need the childcare, but I want her to be able to socialize with other kids. Do the benefits outweigh the risk? This is also a personal choice. I think it's great to consider, obviously the masking rule is 2+ right now, right? For children. If your 3-year-old is able to wear a mask, I think that's awesome. I think you obviously try to encourage that. I do think there is benefit in being in a school setting. And I've said this with older children, but also your, 3-year-old, 4-year-old, 2-year-old. And so it really is what you feel. Like if your child has any medical issues or you're concerned, maybe talk to your child's clinician to see if medically there's any issue. But if it's a healthy child, adding a mask, obviously for them, will help. I understand there may be some taking off and taking on, but that would be a best precaution. But there would be benefit there, right? And then this is, again, a very personal choice. Everyone's making different decisions based on what they want to do. But I also made a choice. We made a choice to keep our son in school. This was a very tough choice because of how Delta's spreading. But we also looked at it as a benefit risk situation in our situation. And it's tough. It's tough because you can't predict the future. You don't know, will there be a COVID exposure? Will there, will we have to pull out for 10 days? So what I will say is anytime you are sending your child back, understand the risk, but also understand, okay, we're doing my best. Maybe if there is an exposure, you said you don't need the childcare. So if there is an exposure in the school, what are my backup childcare plans? Do you have someone to watch your child if there is an exposure and the school shuts down or class shuts down for 10 days? I imagine this is going to be happening more now that we're seeing this spread in kids. So I really advise that if you are sending your child to a daycare or school or something, at this point, it's really important to just just to be prepared to think about what my backup childcare plan is. If you have a partner, talk to your partner on like a call schedule. This is what me and my husband do. Meaning if our son were to have an issue, an issue at the school, who would be the one to call out based on our work schedule, because we both need to work, but we have to also take care of our child. So just talking to your partner, I think this is just really important in this pandemic, especially with this variant circulating, to be prepared, and just really weighing what you want as a family, and just seeing how that goes. Now, if that changes, if you feel like your childcare setting is not taking precautions, and I'll kind of go over what I would like. And again, this is just an ideal situation, and this is also based on the AAP and CDC recommendations too. I would love the teachers to be vaccinated. If they're not, masking is really important for the adults, right? And then I also would like ventilation, so open windows help circulate air so it's not stagnant. If they can do some outdoor activities, that also helps, but just circulating air. Sanitation is also really important, hand washing, which we know, and then obviously vaccination. What kind of mask do you recommend for kids who will be in school all day? Great question. So I was looking at the AAP recommend. Okay, so basically the best type would be one that maybe has like the ones that have masks that are 2 layers inside. So you don't have to don't double mask them, but like they have masks that just have 2 like thicker. That's good. They also want something with an adjustable nose wire is ideal so that it can fit snug here, so it's not loose and falling off. There is some, this is not, again, this is just what's been kind of just being discussed in the community, just a recommendation. N95 or N95 masks. So KN95 masks, these are available from Asia, or you can buy them online. These are what a lot of parents are using, physician friends as well, for their children. It just is one of those like N95 masks that are smaller for children, meaning for your school age child. If you have a 2 to 5 year old, you can just do your regular cloth mask, but you can also do cloth masks for the 5+, okay? There's really, at this point, there is no official AAP recommendation or something that says this is the most ideal mask for the situation. We are just trying to do any masking. Obviously, the couple layers are better than one layer. We don't want to filter, so you don't want those ones that have the valve that actually doesn't do anything and it actually can circulate air inside. So you don't need the valve, just a regular snug mask. And to be honest, the best mask is the mask your child will keep on. So even if it's like a Crayola mask that, is like not double filtered, I want a child to have something on versus taking it off, snatching it off. That's the most important mask. So I know this is really difficult because parents have been asking, which one? There really is no like, you have to do this one. If you don't do this one, it's going to be bad. So really just kind of understanding that. And if I ever do get like, hey, this is what AAP is saying that you need to get this one, everyone should get this one, I will let you know. I talked to them about that today at the meeting. Just, hey, what are the recommendations? And they said the same, what I talked about. So how protected are children under 12 in a classroom if majority are masked but some are not? So this really just has to do with kind of like vaccines, okay? So think about it like if there's 100 people in a room and 98 are vaccinated versus 50. There's more protection there than if 50 were vaccinated. So I think there is some protection there. Obviously, I would love 100% of people to be masked, but I do think that if majority is masked, this is very beneficial. So it's tough though, because we know that unmasked people can spread it, but your child wearing a mask can also help protect them, right? So ideal situation, everyone's masking, but even if you're sending them to school in a class that has 80% masked, 20% not, keeping your child in a mask does give them protection also, right? Protection from touching their face, but also protection from germs getting into their mucous membranes. In my opinion, again, this is just more of an opinion based. If you are in a school that they're not having masking requirements, right? Meaning you're sending your child into a school where it's like this, maybe going with that KN95 or an N95 that's appropriate for children is the recommendation. That's what a lot of people are doing in the community, because that's what we wear in healthcare to protect ourselves against germs. That is an option if your child is going to go into an unmasked free-for-all, right? These are just best precautions here. But you can also do a regular mask, but that's just kind of thinking about that. Now, if everyone's masking, that's great. You can go with just your normal mask, but this is just ways to add protection because I want children to be in school. I think it's so important for them. This has been a long time that they've been out, so this is so beneficial for them to be in there, Would love to know what the AAP told you about kids under 5 years old not wearing masks. It was such a great conversation. I will say they heard me loud and clear about, I advocated for a lot of things. Maybe you were here last time. I wanted to talk to them about frustrations about messaging. And one thing I really asked them if they could do, is that anytime the CDC issues a guideline, if they can come out with a guideline within 24 to 48 hours that applies to families and say, hey, the CDC just issued this. Here's how it applies to you who has a child, right? I think that would be so helpful because sometimes we're left scrambling, like, well, what about the kids? What do we do with this? So I think that's something that they can work on. In regards to the masking under 5, they heard me, what I mentioned was like the difficulty of 2-year-olds keeping a mask on and well-meaning parents trying so hard to keep that mask on. And it's very difficult for some families who are really trying hard. And I understand that. I'm not, sometimes people are like, oh, it's easy. I get it. I have an almost 2-year-old. I think he'll be okay, but it's not perfect, right? So we talked about that. Obviously right now, 2+ is recommended because we do not want to change any requirement in a Delta variant, right? But they are going to look at everything. They look at everything every month. So they look at guidelines every month and then they decide what to change. But they heard it. I said, do any of your people have toddlers that are making these decisions? Like, it's even the most amazing toddler, that is developmentally appropriate. Sometimes they'll take it off, and it's very stressful for parents, that on and off game, So right now we do our best. Remember, the goal here is practice. So I'm going to go over some tips again. Practicing in a mirror with them. I kind of describe it like if we were practicing toothbrushing. So practicing in a mirror with them, you know how when you do toothbrushing, put the mask on in a mirror with them so you both are looking in the mirror so they can see what it looks like, so you can visualize it. Practice at home. You can do a timer, which means every day you practice for a little bit longer. Kids like games, especially toddlers. So, okay, we're gonna do one day, we're gonna do 15 seconds. And we put the masks on, both of you, and you count up to 15 seconds. And then they can press the little timer. And then the next time, 30 seconds. Remember, building it up, making it fun. They can put a mask on their teddy bears. It's how we prep them for any procedure that we do, going to the doctor, dentist, brushing teeth. It's really exposure, and it's understanding that you are also showing them how you do it and modeling behavior. We know that it's not perfect, okay? You try your best here. And I express that. I'm like, I need you to understand that parents are trying here. I don't think parents are, you know, I know that. I've seen this. I've talked to many of you in the office like that are truly trying, and it's hard. But you know how much effort you're putting into it. As long as you're trying, that's the best we can do. But I will keep you posted on anything else I have one of the representatives text cell phone number now, and I'm just really excited because I just really want to advocate for a lot of things here. And they are going to keep me in mind for anything that they need. Just like I'm in Florida where this is an epicenter. So I was expressing some frustration with the guidelines that don't match what local governments are doing and how frustrating that is for parents. And we hear you. But it's just about remembering the guidelines and doing our best with what's happening on the ground, right? Like AAP recommends masking, but in children, in Florida, some of the schools don't require it. So we do our best here. And that's what it's all about. Is it too risky to travel from lower transmission area to higher transmission area to go to in-laws house? We'll stay home or go to beach, all adults vax. So still right now, so the recommendation right now is still the same with travel, which CDC recommends if you're fully vaccinated, you can travel, but you should mask, right, when you're going everywhere. And then for unvaccinated people, that would be your children, you should wear a mask, Sorry, my dog is barking again. Every time I do these lives now, he's like wants to be part of this. Sorry. But yes, you want to make sure that you you want to make sure that if you're vaccinated that you are masking. I'm so sorry. Shiloh. You want to make sure that you are masking. This is real time. I want to go get him, but I kind of want to go get him. Maybe I should go get him. Okay. Let me just open the door. 1 second. Shiloh. Come on, Bubba. We'll see if he comes up. So sorry, I apologize. What I was saying was, if you are... Hello, this is Shiloh. Okay, I'm gonna keep him in here with me. Sorry about that. So what I was saying was for vaccinated individuals, it's still recommended that you mask when you travel. Now for unvaccinated individuals who are traveling, recommendation is actually testing before you go so that you can make sure that you're negative and then just self-isolating when you're there. So I think it's okay to travel, but think about what you're doing when you get to that activity, right? Are you going to be seeing a lot of unvaxxed people? That's something to consider and make sure that you're not, sorry, I ran downstairs. You want to make sure what your activities are going to be when you're there, right? Are you going to be hanging out with a lot of unvaccinated people? That's going to be a little higher risk, or is it just going to be vaccinated individuals? Are you going to be going out into the community? You want to make sure that you're, masking and doing all that. Whew. What is the rate of death among children? It's low. It's low. I mean, we talked about that, but it's still deaths. Let's see. What about, sorry, why are we seeing so much RSV right now? Yeah, so RSV is going around. It's interesting. It's just a lot of this is thought that just because of isolation, we were kind of not, the viruses were not circulating for so long. RSV, we kind of had a mild season because of social distancing, that these viruses are just kind of more active now. We are seeing every virus we see in the winter, we see now. Flu was there, not as much flu, but we did see it. But all of those winter viruses were here now, and a lot of it is just thought that these viruses were just kind of hanging around with no business, and now these children were together. So it's been a pretty rough few months. I know now with this Delta surge, it's even more stressful because kids just recovered from hand, foot, and mouth, and RSV, and all of these viruses. So we don't know what this means for the future. We don't know if this means that they're going to have if it means that we're going to have another RSV, a big season right now. But it's basically in Florida, our RSV season usually is kind of right now till November, but it happened a little bit earlier this year. So we'll have to see. Does that mean that we're going to have another season in the winter? We don't know, but it's been difficult with all these illnesses. My son's preschool is taking great precautions. Am I right to be concerned about in-person meetings for parents rather than Zoom? So I think in-person is fine if everyone's masked. Remember, masking is amazing. So I wouldn't be opposed to in-person as long as everyone's wearing masks. Remember, in any indoor setting, masking is recommended, even if you're vaccinated or not, because you don't know anyone else's status. Oh, this is a great question. My 17-month-old just had COVID last week. He got very dehydrated, but now is fully recovered. I definitely felt that guilt. I'm fully vaccinated. We are so careful. I know. I hear you, and I've heard this happens, right? Viruses come, and even with vaccination, I know this is really hard. Even with being fully vaccinated, viruses can still come into our homes. I was saying that a lot of the children who were in the hospital were from unvaccinated families. That in the hospital, but any one of us can bring COVID. It's so rampant right now. I'm not sure if you're in Florida, but we are seeing those kind of those cases, and I know it can be very hard to do, but I'm so happy babies or your toddler's doing better. Does this mean he has antibodies? So likely he does, but the question we still don't know is how long that immunity would last for, or how much what that means with those antibodies, right? Anytime you get a virus, you do develop antibodies, but even with adults, they saw that even adults who got COVID illness still needed the vaccine. So why is that you won't have as long-lasting immunity with natural infection compared to the vaccine? So that's kind of what that looks like. We don't have any data on antibodies post-children. I imagine there'll be more data maybe because if more kids are getting COVID right now, that we'll be able to say like, okay, what are the antibody profiles after? But yes, but we don't know how long they last for is kind of the question. So likely if when the vaccine's approved for your son, you should be getting the vaccine because it's not probably long-lasting immunity. Let's see. What about kids under 2? So this is a great question. And, I think this is something I talked about with the AP too, is that there's no messaging about what about the kids who can't mask or do any of this. The biggest thing we have to remember is we do what we said earlier, which is the masking for adults, vaccinating adults, right? Think about what we do for all the other vaccines. We do all the other vaccines to protect our children who can't get fully up to date, right? So remember, let's use pertussis as an example. Your baby gets pertussis vaccine at 2 months, 4 months, 6 months, and then they get a booster in the toddler years, and then again at 5 years, right? Your pertussis, DTaP. We do that because we need to build their immunity, right? But how they are so susceptible to get a pertussis illness if they're exposed to someone in that infancy period. So how do we protect them? By vaccinating people around you. That's why we recommend adults get the Tdap, caregivers get the Tdap, right? So that because they're not fully immune or vaccinated, other people help protect them. And this is how COVID works, right? Because there's no vaccine for a child, we are protecting them by vaccinating ourselves so that we, like I said last week, we provide that shield so that this virus can't get to them, right? That is the best we can do with the vaccine, with masking, really considering your social, like who you're hanging out with. Remember, we know that breakthrough infections happen, but they happen, it's more concerning for unvaccinated individuals to spread this. So it's really important to kind of say, well, if I have a child and I have a visitor coming, do I really need them to come if they're unvaccinated? Maybe masking visitors would be a better idea in an indoor setting, or maybe just do something outdoor. Really thinking about those decisions when you make these choices. Let's see. A reference from a doctor is needed for kids to be tested. No, you can get tested without any prescription. You can just go to any state testing site to get tested. Should teachers be wearing their masks outside? This just depends on the role that's happening. I mean, if it's outdoor and things are spread out, they don't need to. Remember, crowded kind of spaces, and I would highly recommend it. But if it's like kind of distanced apart, then you don't need to. It's really about what's happening in that situation. What do you see for fall, winter this year? More surges? It's really hard to say. We don't know what variants are going to come out of this. It's really tough. We pediatricians, I think, for the first time are kind of like, oh man, this is really tough situation. We were hoping that it wouldn't be like this, but it now is, and so we don't know what it means, and it's a little tough. If others aren't masking, these are also, I'm going through a lot of these questions I already answered, which is why. What supplements should my family take? I think I mentioned this before, but there's really no proven supplement to help, like no literature that says this supplement is great. We like to remember focusing on the basic principles here, which is water if your child's older and can drink water. So hydration, sleep. I know this is hard, stress reduction, but sleep is really important in stress reduction, and eating vegetables, fruits, plant-based foods obviously is really good for our gut. So incorporating those kind of foods into our diet, smoothies for kids, veggies on their plate, fruits and stuff like that is really beneficial to them, and our gut health is part of that. Probiotic yogurt I really like if you eat dairy, but probiotic rich foods are really good for our gut health, which our immune system is largely in our gut too. So really giving good foods to our stomach is really important for our immune systems. Benefit to a shield for an infant under 1, obviously without a mask. There's no data at all to talk about this, unfortunately, so I can't speak to that. I really don't want to, I don't want to give you a false sense of security, saying that it's okay when it's really not. I know a lot of people have been I've seen it, those little baby face shields. So yeah, I want to be very honest, like it's likely doing something, but we don't know how efficacious. So just kind of still taking your other precautions that you're vaccinated, other people around that baby are vaccinated would be very beneficial. I love these lives, so informative in a language I understand. I love it. I'm so happy. I'm so sorry about my dog barking. That made me feel bad. Oh man. And then you also saw that I'm wearing shorts on the bottom. Whoops. I don't normally do that, but today I was like, it's kind of hot. Let me just do shorts. And then I got up. Oh, this is real life, guys. Real life right now. What are your thoughts about the variant Lambda? I really don't want to think about it right now about Lambda. It's just, I want to focus on Delta. There's just a lot, right now. Like I said, I'm taking it every 2 weeks, every 3 weeks, kind of realizing what's happening and approaching y'all with what's happening to keep you up to date week by week now, okay? Are indoor extracurriculars okay, dance class, if everyone is masked, or should we skip it? I think so remember, these kind of decision makings also have to do with benefit and risk, right? Benefit is like for your child who loves dance class. If it's indoor and everyone is truly masking and takes a responsibility to wear a mask, this is awesome, right? This is great. Now, if your child has a medical issue that you're concerned about, maybe not, right? But if it's a child who is otherwise healthy, everyone is wearing a mask, your child's wearing a mask, this is something really important to your child, indoor masked is fine, right? This is one of those situations that you look at benefit and risk. Remember, I don't want you to think that you can't do anything in a pandemic, but it's about the decision I'm making, whether it's an indoor dance class, whether it's an outdoor this, what can I do to reduce my risk right now? And with the variant surging, it would be masking everyone inside. And I think if everyone's doing that, that's awesome. I think that adds to risk reduction, which is what this is all about. First, and again, I'm answering all the questions that I'm able to answer in terms of being a pediatrician. There's so much like public health stuff that I don't want to get into because I'm like, obviously pediatrics is my specialty, so I want to go into all of that stuff. Let's see. Do you know which Broward hospitals are on divert? Right now, I can for pediatrics, I'm not sure. Adult, it just depends day by day. My husband's hospital only has one more ventilator, so it's tough. I really think we need to remember how dire the situation is and how we need to, really, like I said, the bigger concern is obviously our adults who are not vaccinated. The 25 plus group is who's not vaccinated. But what we want to do for our children too is protect them and you're doing everything you can right now. Remember, and you're here to learn that, and you are. Thoughts on the one thing I want to go through right now, because someone had mentioned this in a question that we got, is about is this all affecting our children's development? And I'm worried about mental health. I'm worried about like development overall, like all of this masking and this and social distancing, and it's been so long. And I want to first empathize that I hear your concern. I know this can be really tough thinking about, wow, our children for 2 years 3 years are doing this. But I also want to remind you that our children learn from what we do, right? Our children, regardless of the age, they are learning how we approach situations too. So I really encourage you to remember that they are very resilient. They will adapt, right? It's not like they're not seeing any human beings. And remember, the goal here is having some social interactions with precaution. You don't need to isolate them on their own, right? You can obviously have vaccinated family members nearby. You can think about all of that. You're not depriving them of social interaction. You are just making some risk reductions to make sure that you're trying to reduce risk for your child. So I don't look at this as a negative. There is no data to support any sort of detriment to masking, to social distancing, all of this. Of course, when we look at it as like a social piece, right? Like as human beings who are social beings, of course we want the kids to be together. But there needs to be some precaution there so that we protect their peers, we protect them. This is all important stuff so that we can, keep each other safe and get out of this. But as a mother myself, I would not worry about any detriment to your child's development. They have they're not in a mask 24 hours a day. Remember that if they go to school, they're in a mask. And our school age children, I'm not worried at all. Like school age children, they can wear a mask without any issue and be fine, right? They are fine. Your 2 to 5 year old, people worried about speech development, this and that, they have you at home. They're not wearing their mask all the time. They are able to learn about language with eye expressions and other things. So I don't want you to think they're being damaged or anything like that. That's not at all what's happening. You also have to think about just keeping them healthy, and this is a balance that we're trying to do right now. But if you have a school-age child and you're worried about, well, what are they thinking? I promise you, they're fine. You're probably worrying about it too much about your school-age child, that, oh, this and that. I promise you, kids are actually truly go with the flow. They are like fine, and in a good way. This is nothing harmful for them. They can keep that mask on. They can learn. They can breathe. They can talk to their friends. They can play. They will do what you model, right? And we want to be that model and say, you know what? This is what we're doing right now. Kids all over the world are in masks in school. We can do it too. This is so great, everyone. I think let me scroll. And then I want to remind you that on this page, Pediatric Associates feed, they have a great infographic on what to do if your child has COVID. I think it's really important to read. It talks about, when to go to the hospital, symptom management. I think it's really great. Just go down their feed just to make sure. I bring that up because people are asking about symptoms and this and that. I think it's such a great thing to have so that you can really know, like, well, what if this happens to me? What do we do and stuff like that, so you're not feeling alone or isolated. Someone's asking about outdoors. Outdoors is definitely less less transmission than indoors. But if it's like a crowded party or concert or something like that, I don't know if you're taking your children to concerts, then masking would be recommended. Let's see. You all are so welcome. I'm so happy that we can do this every week. This is so great. Okay, awesome. So cute. I'm getting to the part with Shiloh. That's so funny. He's sitting right here with me now. I'm gonna show you all. You guys get a little personal life. Shiloh. Hi, Shiloh. Hey. Next time I'll bring him. That happened last time, and when my husband's not home, he barks a lot because he's trying to protect me, so it's very sweet. Thank you all for joining me today. Next time I'll bring Shiloh into the room if my husband's not here, so that he can join us and feel more secure with his mommy nearby. I have a very attached dog, which is good. But thank you all. If you have any questions that are, make sure we bring them next time. We'll try to get on and respond to questions on the post. If you have any further ones, that's not always possible with time, but we'll try our best to get into into the messages section. But make sure you save this and share it if you found it useful. And I'll be here next week. And if there's any major update that warrants a sooner live, we'll do it. But next time we'll do this is 8 p.m. next Thursday. But thank you so much, and I'll see you next week.